I hear your skepticism. I know we've heard it all before, the miracle fat reducer, but here at the Baylor College of Medicine, they say that this machine might be onto something. The machine has little pulses.
Registered nurse Elaine Wells says she tried this device in order to better serve her patients, and just like that, she has started to lose inches around her midsection.
And I've lost 2 inches.
Baylor is the only Houston hospital with this non-invasive fat removal option. It's called UltraShape. It's described as an ultrasound. One of the doctors got on the table today to show me how it works.
Feels like a buzzing sensation, painless. It's really very comfortable.
No surprise that this time of year patients are craving fat loss as a side order to the holiday gorging, and Wells says there's a real science to help aid your diet.
It's transmitting ultrasonic waves, which are just breaking up the fat cells.
This requires 3 treatments on each area. The bigger the area, the longer it takes, but all 3 sessions will total about $3,000. But don't let your eyes get bigger than your stomach. This treatment isn't intended for a tremendous amount of weight loss, but as the doctors say, for sculpting and thinning of specific areas.
So unfortunately, this is no get-out-of-jail-free card. This is specifically for people who already have healthy lifestyles but need a jolt with problem areas.
All right, well, let's talk about devices. Let's talk about non-invasive body contouring. Can you tell us what are you most excited about right now in terms of technology?
So there's a bunch right now. So I think we've come a long way in the body contouring and the skin tightening, making fat go away. And what we're seeing is that some of the devices are moving to the top. They're more popular, at least where I live, and we'll start with UltraShape, okay, which I think you've talked about a little. But UltraShape is this, it's focused ultrasound, and it's able to penetrate deep into the skin where we can actually break up the fat, and it's penetrated into the fat. And if you do this in conjunction with other things, such as in our case, we use what's called VeloShape 3, or we use something pretty brand new called the Zimmer Z-Wave, which is a shock therapy. It helps the UltraShape work better. So you'll hear a lot about UltraShape in this market and around the country, and it's a great device, and it works, you know, painlessly to reduce fat in people that are not obese. So if you have pockets of fat, especially the stomach, but you can actually do the love handles and other areas if you know what you're doing. But it works even better if you add things to it. So if you take a device which is like the VeloShape, which is a radio frequency device, or the Z-Wave, which is it's basically a shock device, an acoustic shock wave device, you can actually pound in the ultrasound even better. So the combination is sort of where it's going. And if you understand anything about it, you know, one device is great, but adding 2 things to it, you know, makes it even better. And so that's sort of what our patients are getting now, and the results have been pretty impressive.
Well, I love this hybrid approach to body contouring. We haven't heard that before, so that's fantastic.
Yeah, but I mean, so again, one thing works, but if you have ways to make things better, I mean, that's really what we're looking for. So we do these additional things to give us an added benefit for our patients.
Great. Well, thank you so much. It was a super helpful trend report, and we will speak with you soon. This is Dr. Michael Gold. Let's talk about non-invasive body contouring, specifically UltraShape. Can you tell me how UltraShape is different from other forms of non-invasive body contouring?
Yeah, UltraShape is completely unique, as opposed to, for instance, methods of using cold to destroy fat. Yeah. This uses sound, actually, ultrasound. So it shakes up the fat, makes little holes in them, and allows the fat cells to die and be processed by the body.
So what is best, heat, cold, or ultrasound? What's most effective?
Well, the newest thing is sound, and that's what UltraShape is. And nobody's ever done a head-to-head comparison between these, but I've used all the different instruments, been involved with UltraShape for a number of years and doing research for them. And this is a unique way where your body does not have to match the machine, as in some cases, but the machine actually customizes and matches your body.
So what exactly happens with the ultrasound? Does it destroy the fat cells? What happens in layman's terms?
it destroys the fat cells completely. So they're permanently gone. So you're always better off having had this done.
Okay. And when they're destroyed, does that mean that they'll pass, or they're like, what's the process afterwards? What happens?
Well, they basically are dissolved by the body, cleared out by the circulation. Your body has an amazing capacity to get rid of fat, like after you eat a Big Mac or something. Just process it right out of your body.
Who makes a good candidate for UltraShape? Is it something where you're like 10 to 20 pounds overweight, or is it a weight loss tool?
It's nothing to do with weight, because weight can so often have to do with muscularity, build, that sort of thing. This is for areas of localized fat. So basically, if you have an inch to pinch somewhere and you want to reduce that, this is a way to do it.
Okay, so an inch to pinch is a great way to see if you're the right candidate. And as far as time off, is this something I could come in and do during lunch or over the weekend, or is it something that needs a little bit of downtime?
Really almost no downtime. You could literally do it at lunch, and you could go out to dinner that night.
Oh my God, well that's exciting. And how many sessions typically does somebody need? Is it a one-time thing, or how many?
This is a 3-time treatment, and so, but the treatments can be done very close to each other. So our patients come in on day 1, day 14, day 28, and they're done.